This is LiveWell talking COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. In today's podcast, we'll give an update on COVID-19 and reflect on the past year and where we've come from, as well as discuss the influenza season. In the hospital, we are seeing it's continued to be patients that are unvaccinated. About 85 to 88% of the hospital COVID census is unvaccinated patients. And in the intensive care unit, less than 10% are vaccinated. So it'd be 90%, a little over 90% are unvaccinated. So, what can I say about that? I can say that the vaccines protect people from death and disease, meaning it keeps them out of the hospital. And if they do get admitted to the hospital with a breakthrough infection, subsequently, then they have less of a chance of ending up in the ICU. Link count remains in high transmission with cases per 100,000. However, our positivity rate, which to get to moderate transmission has to be less than 10%, and it was a 9.4 this week. So that is something to be optimistic about. We have seen influenza B and influenza A in the community. This week, 2 cases of influenza A, which just reinforces the need to get your influenza vaccination and COVID booster if you're in a category of patients that's eligible for such. It's been a dynamic week as far as medications coming forth. Merck has a oral pill, and Pfizer has requested emergency use authorization for a oral medication, and they'll meet at the end of the month. So I think by the end of the year, we'll have both the Merck product and the Pfizer product for outpatient pills to prevent the replication of the virus and keep people from getting sick. And that's good news. But let's reflect back over the past year, how far we've come. Today in the hospital, I'll just give you the raw number. We have 17% of the hospital census, and we're full. 17% of the hospital census is a COVID patient, with about 50% of them in the intensive care unit. 1 year ago today, which was our peak of the second wave, or the wave that came in the fall into November, and we had a total of 50%, 49% actually, 50% of the hospital census was COVID patients. So that's roughly 81 patients that were COVID compared to today's, which is about 25. And the hospital is still busy. And as I reflect the past year, back then, what did we have? We did not have monoclonal antibodies of any significance at that time. We did not have the oral pills that are coming along. And it wasn't quite clear on what role the interleukin-6, the Actemra, those kind of drugs, how they would influence this, or the Janus kinase inhibitors. So we're using those medications now, but at that time it was kind of questionable their efficacy. So all we really had at that time was corticosteroids and remdesivir, which we struggled to supply that at one point last year, where reflecting back and looking, we had a year ago today, we only had 66 doses of the remdesivir with over 80 patients in the hospital. So that is impressive that we had such a significant amount of patients, and we're able to arrange for them to receive the remdesivir. Learned a lot in the last year, and I'm excited for the oral medications, and I'll keep you updated on that as they come along. That's the end of the COVID-19 update, but stick around. We'll be right back with another episode of the Mailbag. Welcome back to the Mailbag. The Mailbag is a new segment on the podcast where I'll periodically answer questions submitted by listeners. Today's questions on the Mailbag segment with the update are COVID-19, but it can be just general medical questions that we'll try to answer. The first question comes from Mary. What treatments are currently being used to treat COVID at St. Luke's? Well, I listed some of them in the update this week, but we have the corticosteroids that we use when the patients are in the hospital. In addition to that, oxygen, and we've mastered the ability to deliver high flow oxygen to patients and avoid going on mechanical ventilation. Additionally, we have the monoclonal antibody, which has significantly influenced hospitalization rate. I think we spoke last time, we've over 700 infusions. This was early in the month of November when I counted them up, and we had less than 4 people admitted to the hospital. So that's pretty impressive from a standpoint of preventing hospitalizations. We also have 2 interleukin-6 medications that we can use. One is Actimra, and the other is Illuminate, I think, Illuminant. I can't remember exactly how to pronounce that one, but both those are used when the patients require oxygen and have significant illness, and it blocks the overwhelming immune response the patient is receiving with the COVID infection. It blocks that and slows down the cytokine storm, is the medical term for that. Good question. Our next question is from Kristen. If I was vaccinated with a Pfizer in January and February and got COVID in August, do I need my booster? That depends. If you are in the category where you may not have manifested a satisfactory immune response, meaning that you have a solid organ tumor, you have some sort of blood disorder, you're at risk to not have an adequate immune response, yes, you need a booster. If you're just part of the general population, probably not at this time. And I would wait at least 90 days from your infection in August before getting the booster, if at all. If you're part of the healthy population, you wouldn't necessarily need the booster. Next question is from Maureen. In addition to testing prior to procedures, could you please describe the steps St. Luke's takes to prevent the spread of virus to healthy patients who are undergoing screening procedures as outpatients? For example, colonoscopies, outpatient mammograms, etc. First of all, we have universal masking. So our staff and physicians are masked to prevent the transmission, prevent them from giving an infection, whether it's COVID or influenza, to other individuals. Additionally, we have the vaccination mandate or requirement for both influenza and COVID-19. And I think we're in the 90%, almost 100%, 98%, 99% of the staff vaccinated. So a small fragment of staff either perhaps had a religious exemption or a medical exemption, deferral because they're actively pregnant. But they too continue to use the universal precautions with what's called droplet and contact precautions as needed. The next question is from Diane. How long should I stay away from someone who had COVID? Definitely 14 days. Then they're COVID recovered, but there's evidence that by day 9, by day 10, the person is no longer infectious, and even though they're still recovering from COVID. But if you want a solid timeline that's definitive, that would be 14 days, avoiding contact with COVID. And likewise, if you have COVID, you should not have contact with people for 7 to 10 days, preferably 14, after you've had the illness. Our last question is from Jamie. I've had about 5 COVID tests and they all been done differently. This concerns me of the accuracy of the test. One test went clear to the sinuses and the swab was twisted for 5 seconds. One was the same way, but both narrows. The most recent one last week was a swab barely inserted in my nose and not turned back and forth at all. Could you possibly share what is the correct way to perform the test? The correct way to perform the test is to go deep and twist it. I believe it was 15 seconds, but it may be less than that. Obviously, I'm not collecting these tests on a regular basis. And to do both nares. And then process the sample from there. So it should go deep. And that was one of the concerns that we had when the pandemic started, is, I know we had one lady, she was admitted to the hospital. She had contact with the trip that went to Egypt, if you remember that, from Iowa City. And we treated her as COVID, but it came back negative twice. And I still think that was a false negative. And I think it was because we weren't used to sampling it. So sampling, it is a procedure, and there is a technique, and there is a little bit of skill to doing it. And I think it just reflects that our laboratory personnel are really talented individuals, and that they play an instrumental part in our ability to care for people and patients during the pandemic. That's all for the mailbag today. If you'd like to submit a question in the mailbag, go to unitypoint.org/mailbag. I'll answer questions about COVID-19, the latest technologies and procedures, services provided by UnityPoint Health Cedar Rapids, and other medical topics as they present. Please note, however, the mailbag is not an alternative to a medical appointment or seeing your primary care clinician. Any questions about personal symptoms or conditions will be referred back to your primary care provider or urgent care. And as always, if it's an emergency, go to the nearest emergency room. If one is not near, then dial 911. Once again, you can submit your questions to me at unitypoint.org/mailbag. That's unitypoint.org. Common spelling, mailbag, MAILBAG. I look forward to hearing from you, our amazing listeners, and the intelligent questions that are provided. Thank you for listening to COVID-19 Update. For the latest COVID-19 vaccine information and more, visit unitypoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.